we have so many different hospitals and with the different requests. In order to filter out and prioritize, we need very accurate information. So the volunteers really did their due diligence to understand exactly, what's happening in the hospital.
Welcome to Plant-Based DFW with Dr. Riz and Maya. Dr. Riz and I interviewed Keren Wang about 10 days ago as we made another trip to pick up PPEs. This is the personal protective equipment from an organization called DFW Care. This is a local Chinese American organization which self-organized almost within 24 hours as part of a WeChat conversation that they had, and they feared the devastation that could take place here in the Dallas area as the coronavirus was spreading throughout the country. Keren Wang is part of the DFW Care organization and works in the hospital assessment group. She has worked closely with Dr. Riz along with other physicians to assess their hospital needs. The organization has worked tirelessly since early March to support Dallas healthcare workers. The group will dismantle and kind of wrap up on Saturday, April 25th, since the Dallas area was fortunate enough not to see such a huge spike in the COVID-19 patients compared to other areas in the country. And we would like for you to hear their story and visit their website to show support and to thank them for their hard work. The website is www.dfwcare.org. And here is our interview. Welcome back to another episode of Plant-Based DFW with Dr. Riz and Maya. And today I actually have Dr. Riz. Welcome, Dr. Riz.
Yeah, I don't get to participate on all of our podcasts because I'm busy at work sometimes, but fortunately and gratefully I get to participate in this one because this one is extremely important to me.
This episode is really part of a COVID-19 series. Anyway, let's talk about this organization called DFW Care. This is an operation that began as a simple conversation among friends and neighbors about what they could do to help slow the spread of COVID-19 in the U.S., especially concerning the DFW area. The conversation quickly heated up when they learned that hospitals and medical personnel were running out of personal protective equipment, which is also called PPE. Recognizing the devastation that a short supply of PPE could cause, they decided to help local medical institutions prepare for the pandemic. They want to unite the community and raise money as well as PPE for the heroes who are providing emergency care and fighting COVID-19 for all of us today. Who we have today is actually Keren Wang, who is part of DFW Care. And we thank you so much, Keren. We know that you're very busy right now. You stay busy every day, and welcome to our show. How are you?
Very good, very good. Thank you so much for inviting me to this show.
Thank you for being here.
Yeah, we're very excited to have you. I mean, as a physician, I really admire what you guys are doing, and I can't wait for you to explain it more so that we can get the word out and share this with other people. So why don't you start by telling us about a little bit about DFW Care, how it came about, and what your role in DFW Care is.
DFW Care actually started with Dr. Fuqing Liu, who's professor in the women's university, and she had a friend circle with nurses around the country, and she's hearing people asking her, talking about that running out of PPEs in their hospitals, and she get concerned, and she started to talking to her friends, and then March 17th, that night, we actually formed a WeChat group. WeChat is kind of like WhatsApp app in the Chinese American world. So we actually group a bunch of people together on that night on March 17th. Soon after, I think on the next day, we came about close to 500 people in the group.
Wow.
So yeah, it was kind of running really fast because everybody is concerning about this coronavirus, and because the Chinese people, Chinese American has experienced our families and friends back in China experiencing, coronavirus in China. So we have been watching this for so long, and we've been seeing so many medical staff in China that was, risking their lives and, going to the front line and fighting the diseases. And so a lot of people actually, passed away because of this. So we were very concerned about, the medical staff in America, when we encounter this here, what's going to happen. So a lot of people are very, very concerned. And so quickly, just within a day, we formed a core team with about 7 committees that's in charge of financing, fundraising, and hospital assessments and connections, communications. And also we have the purchasing group, and we have more of, working with the public to medias to spread out the words. And we also have the team that's in charge of, sending out the materials once we have them. So we have multiple groups, just have the leaders set up within one day.
Wow, that sounds like you basically set up a business in one day with all of the departments, you know? You got marketing, distribution, fundraising, organization. I mean, that's an amazing amount of work. And just to think, literally, that was just not even maybe 3 weeks ago that you guys got started. That's just amazing.
Yeah, thank you so much. And we did our best because we know we ran out of time. We're running against time, actually,
Right, yeah.
to save lives. So what we did is that, we're, especially the core team members, running around the clock trying to get things, set up at the beginning. And then within 4 days, we raised $80,000 and then sent the first batch of PPEs to hospitals.
That's amazing.
Oh my goodness. And where did that funding come from?
The funding actually coming from the community, just from the WeChat, people joining the WeChats, they are just pouring money in. And also one of the volunteers in my group, which is the hospital assessment group, she kind of she worked with Baylor Hospital series. So and she actually sees the needs, and she kind of came up to me and say, Keren, I have a personal family foundation that I would like to contribute to this effort, because I know you guys are doing great things, and we are doing great things. So I would like to contribute $50,000 to this effort.
Wow, that's amazing.
Yeah,
Oh my
yeah,
gosh.
that's just the second day or third day, I don't remember, but we got this amazing funding, and then we immediately secure the local vendors to get the PPEs put together, and then the next day we purchased the PPEs and sent to the hospital.
Wow.
Yeah.
So I think it's the part of the concerns and part of the efforts. We see the needs, and we see how much shortages out there that really needs help. So people just pour in their heart into this effort.
Keren, the core group that was founded, and you said it was through WeChat, are the majority of the members located here in Dallas, and are they mainly Chinese American?
Yes, they are living in Dallas, and they're mainly Chinese American, yes.
I think that's just absolutely incredible that you guys managed to put together such a strong and organized group.
We have people from different fields with different expertise and bringing together in a core team. And we have actually the people managing the purchasing of the merchandise are actually the ones helping buying stuff over to support the Wuhan at the time. So when Wuhan was in was in great need at the time. So they were the same people that's helping us on our our effort to purchase the merchandise as well. They were not really, expert at the beginning before, but throughout working for, getting the merchandise to Wuhan, they kind of learn all the aspects, regulations, and different models, what they do, how they can help the medical staff, so they know the ins and outs of everything.
Yeah,
Became the experts.
So you were able to quickly assimilate them into your group, and they had a certain level of expertise in procuring these things, which they'd already done for one region, so now they can apply it for another region.
Exactly.
Keren, I wanted to play a clip that really touched us. Dr. Riz and I sat down when we first learned about your group and heard an interview that Dr. Fuqing Liu gave, which then moved us to not only donate, but want to support you guys in however we can, like, for example, with this podcast. So if we can listen to this clip real quick, it's just a couple of minutes.
So we're actually going to buy extra 50,000 more supplies, even though we don't have the money yet, because we have a sense of urgency. And we get individual requests like this, on a daily basis. We have so many volunteer groups now. Now we have another extra volunteer group. They're doing homemade masks. There are more than 100 people in that group, and then there are ladies working until midnight, and they show their pictures of masks they've sold, and they've made, and they posted in the WeChat group, and they are working also around the clock. So I'm just kind of overwhelmed, not only because of the sense of urgency, but also because of the dedication of the volunteers. So I know the Chinese American community are super vigilant about this because of what's happened in China, but I really would like other groups, other ethnic groups or the mainstream, the people to really know this is serious. Let's do something now to make it less, not as bad as in New York. We want to protect our healthcare providers and frontline workers like firefighters and policemen. So let's do something.
Keren, when we heard this, we were listening to the interview together, Dr. Riz and I, and we were really touched. You can hear in Dr. Liu's voice, there's, like she said, a sense of urgency, but sort of very heavy-hearted about the devastation that has not only happened in China, but now the fear that this is going to happen in Dallas as well. Tell us more about that sense of urgency that you guys have.
Yes, when we heard that it's coming to New York, how the situation happens in New York, we know it's coming, and we know that, in the next a couple of weeks might be very, very, critical to us that, if we don't protect our neighborhood, our city, we could end up in this, devastating situation as well. So, we already kind of have the understanding of this social distance regulations at the time, but lack of PPE supplies all across the board is very, very concerning to us. So, after the first batch we sent to the hospitals, and we got flooding in of requests coming to us, and from the nurses and doctors, saying that we're running out, we're asking to wearing a mask for 10 days, stories like that really concerns us. Mm-hmm. So we worked around the clock, getting the PPEs from China. Mm-hmm. And then we also working around clocks, trying to understand the situation of the hospitals. Mm-hmm. And then, like Fuqing said, we also have ladies, just working from home to make the masks to help, providing our public with additional, mask supplies. Mm-hmm. So we try everything we can just to save time, and then to provide people enough I wouldn't say enough, but trying to provide as much as we can to help our medical professionals, and also to help the public as well.
So I will tell you from personal experience, of course, I'm so grateful. You've helped my primary hospital, Baylor Sunnyvale, and for those of you out there listening, what they did is they asked us, what is it that we need the most, and we can help. We helped prioritize, and they were able to provide us with personal protective equipment, which we were in low supply, and kept us going. And that's just an amazing thing. So, thank you, Keren, and thank you, DFW Care. I understand that you've helped dozens of hospitals. Tell us about some of the other hospitals that you've been participating with.
I think at the beginning, we work with Baylor's system, working with the sourcing department. And then we started to receive more of the requests from doctors and nurses. And then after talking to them, and then they go to talk to the hospital sourcing department or their department leads, and to mention our effort, and then if they would like to take our donations. So we kind of are going from cold calls at the beginning, because at the beginning, when I started my group, which is the hospital assessment group, we have nothing to start with, actually. So I worked with a public health professional to actually check out the database that she can access to find out the list of the hospitals that's in Dallas County and Collin County, which are the higher number, which are the counties that has higher number of confirmed cases at the time. Mm-hmm. So we started with those with the higher ranking of the hospitals in those two counties, and then we started calling those hospitals, finding out from the internet their calling number, and then we called the hospitals and started from there. So the first batch actually coming from the cold calls, which means we just contacting the hospitals and see if they have any shortages. Yeah. And then we did receive the forms that they filled out with the number of PPEs that they are really lacking of. So based on those numbers, that we started our first purchase. And then later on, we started receiving calls and spreading of the concerns on Facebook and next door. That's how we get it more of the requests from different angles.
Yes, and as a matter of fact, I was going to comment that that's exactly how we found out about you guys, was through Nextdoor. An associate that knows you guys, that is probably part of the group, was the one that posted the information. And at first I thought, this has got to be unreal. There's just no way that this group is just voluntarily putting all this stuff together. So I first ran it by my husband, and he said, really? Oh, okay, let's go ahead and apply and submit an application for some PPEs. And then we finally visited your one of your centers where you're distributing the products and the supplies. And it's just incredible how well organized you are, and how you are spreading the message and letting people know through social media and Nextdoor as well.
Yeah. Actually, I was amazed and touched. I mean, so if it wasn't for someone from your organization posting to the Nextdoor app, and then if it wasn't for my wife, who monitors that app regularly, then she comes to me. So through that chain of events, my hospital and the staff at my hospital got to benefit from what it is that you guys are doing.
Keren, I don't want to forget to mention RAM Union. Do you want to tell us about that other organization that you've partnered with?
RAM Union USA is a volunteering non-profit organization in America, and they formed just a few years ago. They are just helping out the communities and putting their effort to help out wherever they can. They are still they consider themselves still new to the community. But in this effort, when we just formed the first day, we are all volunteers. We don't have any organizations ourselves. So we're trying to see if we can find a nonprofit organization who can help us, and then they come and join and became our core leaders as well. And the president of RAM Union actually is a critical part of our core team, and he's he and his staff helping us collecting the donations and publishing it on a daily basis. This is amazing because I've been experienced with other fundraising in the past many times, but this is the first time that I encounter some organization actually publishing their donations on a daily basis, and then people seeing that their money is putting into a good use and recognized, and they are just pouring more money in to help out.
Yeah, that's great that you've been able to partner with them. It probably has furthered or helped your efforts to raise money for your cause.
Exactly, and just recently, I think last week, RAM Union actually received additional support from China. There's a brothers organization in China. They sent in more than 20,000 masks to here in Dallas.
Wow.
So RAM Union was able to distribute these masks to fire stations, and also police stations, and elderly homes, nursing homes. I think they sent out to more than 15 of these places.
Oh, that's amazing, especially right now when we do have some firefighters that have already been that already have COVID-19.
I don't know about the Dallas statistics, but certainly first responders in New York are at high risk.
Yeah, exactly. And today I just got a friend telling me that a police officer got infected, and their whole family is in quarantine right now. And she's asking if we can provide some KN95 masks to them. And then we are just working through that today.
So, we talked about the hospitals earlier, and you've actually benefited many hospitals, and of course the staff of those hospitals. Early on, were you running into any kind of red tape and bureaucracy and getting these things to them? And how did you work through that?
Yeah, at the beginning, we as a organization that nobody heard of, trying to reach out and help, and some of the organizations did not answer, but majority of the hospitals did answer. And then we did have to work through the hoops in order to get the waivers signed, and then to collect the right information from them. So we did go through many calls and texting and emailing. So we have wonderful volunteers in our hospital assessment group. They are very patient, and they're just working through to for one thing, to let the hospital understand what we're trying to do, what we're trying to help. On the other hand, just to understand exactly what the hospital needs, because we have so many different hospitals and with the different requests. In order to filter out and prioritize, we need very accurate information. So the volunteers really did their due diligence to understand exactly, what's happening in the hospital currently, what the situation is, how how many people really caring for the confirmed cases, and how many people we can consider the second line, which are not directly interacting with confirmed cases, but they're kind of in a risk as well. So we're kind of understanding the exact situation, and then prioritize accordingly, because we have very limited PPEs. We wanted put it into the, the most critical places
Sure,
as
sure.
as much as possible.
Yeah, I can speak to a little bit of that from my experience being in the medical staff structure of my hospital. Hospitals are often burdened by a lot of administrative bureaucracy. And fortunately, people are more receptive and more open during this particular crisis, and are looking for ways and pathways to make things happen faster and easier. So I think that's one thing that I've seen. And then secondly, in my own personal experience when working with your organization and me working with our materials management people, we've critically looked at and said, we're not going to be greedy. We're not going to just ask for everything. What we, you gave us a list of things that that you had as possible things to donate. And we looked at our supplies and said, well, we could use this and this and this, but we'll pass on these things because we would rather these go to someone else who needs those more urgently than we do.
Yeah, Dr. Reese, we really appreciate this kind of help. Yes, and we hear this from other hospitals as well. We really appreciate hospitals are concerning, their brother hospitals, and just sharing one is sharing the donations with others, so, and also referring other hospitals that's in need to us as well. So I see this kind of caring among hospital staff, and we really touched by that as well.
I work in an area where there's 3 different hospitals that are owned by 3 different companies, but they are working as a coalition to serve the community as a unified front. And I think that's just a wonderful thing.
Just going back to the topic, I would like to mention we did encounter some of the bureaucracies that the hospitals just did not want to accept donations from, from communities, but asking their staff to go find the masks themselves. And I found this very sad that they they don't want to take responsibilities and let the staff to seek out for help, and then that just I don't know what to say, but what I can do is just providing these medical staff directly the masks and and the protections that we can provide, and they can just sign the waivers themselves.
Yeah, that's a little bit of that red tape that still sticks around because a lot of these corporations are afraid of the liability. I can tell, you talk about the face masks. The face masks can't be used in my hospital, but there are other places that will take them. And the community will, and doctors' offices will, and nursing homes will. And especially now that they've finally admitted or said that everybody should be wearing a mask, everyone's much more open to it now.
And I think more and more hospitals that in shortages are open to our donations, and that they are cute. At the beginning there might be some suspicions, but once they see the merchandise that the PPEs we send to them, and then they see the quality that we provide, because we have our experts that's filtering out I think 50, 60, maybe close to 100. I don't have the exact numbers, but they have just so many suppliers coming to them, providing the information, and then they have to filter out and find out the more, I think, familiar channel to provide to as our selected vendors to purchase from. Mm-hmm. So they're very, very picky on what kind of PPEs to choose from.
Where do your supplies come from?
Majority of our supplies are coming from China, and through the channels that we're familiar with. And not only selecting the PPEs are difficult, but also sending it through the supply chain is very difficult as well, because we have some PPEs to stay in a place, could not get on a plane for a long time. So we also have situation that we have merchandise stuck in the custom for several days, still not coming out. So fortunately, we have very, expert in the supply chain area that can help us through this hurdle, so we can have our material come in like in a few days.
Let me ask you, Keren, what is the greatest need that DFW Care has right now, and how could our listeners and the public help with either volunteering or making financial donations?
At this point, I think we just broke even recently, and thank you for all the donations we received recently. At the beginning, when you hear Dr. Fuchin Liu talking about that we have 50,000 in debt when we just trying to get the PPEs in, and now we're debt free. And as I talked to Dr. Reese today, that we're trying to buy additional PPEs from local vendor so we can distribute them quickly, and especially the protective gowns and like the gloves that we don't have any in stock currently. So we're trying to get them in, and thank you, Dr. Reese, for giving me the advice.
Oh, of course, anytime.
Merchandise we can get can really help his staff and other hospitals. So that's really helpful.
The healthcare workers being on the front line are at particular risk, and if you look at some institutions, they're saying that as many as 10% of the healthcare workers are becoming infected, and it's because they're not being protected well enough. And so what you guys are doing, you're flattening their curve. You're giving them supplies to protect them from getting infected, and hopefully we won't see those same numbers here in the Dallas area because of the wonderful work that you guys are participating in.
Definitely. And I also like that on your website you mentioned you have another plan in case those PPDs are not in use or not as needed here in the Dallas area. So you would donate those to other organizations if you found yourself no longer needing them, right?
Yes, exactly. Yeah. And we actually have more help pouring in because, all the media coverages about our effort, and we might receive more donations to us as PPEs coming to us, and then we will definitely distribute it, handing it over to other organizations to distribute it to our communities, and helping more people.
So let me ask you two specific questions about how people can help. Number one is, if people have products that they can donate to you, who do they contact?
We did receive a lot of donations from our community, that people getting their families and friends sending the masks to them, concerning them, and then they said, I don't need this much, I can donate to other people that they can use. So currently the donations are scattered and actually distributed among ourselves, to others, to neighbors that doesn't have any masks, situation like that. But I would suggest, going forward, if we can, to directly donate to the hospitals or to the areas that have donation boxes.
Okay.
That so I think what the media can help is that publish that those locations, and then people knows where to go to donate their extra materials that they want to help out.
Okay. And then the second one is specifically for financial donations. And I already know the answer to this because Maya and I went ahead and made a little donation. But can you tell our crowd where they can go to make financial donations?
Yeah, they can go to www.dfwcare.org, and we have a donation menu where you can go click and go there and see which way you prefer to donate. We have different ways of PayPal or QuickPay or GoFund, those kind of different methods to donate.
Yeah, wonderful, wonderful. And what I would encourage what I did is I also shared it on my Facebook page and my timeline, and I sent it out to lots of my friends, some of whom have already donated to, and I'm grateful to them for having done so. So for our audience, I encourage you to go and give a donation. No amount is too small, and then use your social media to share this, because we know the power of social media and how quickly we can spread a message from just one person, and suddenly 10,000 people or 20,000 or 50,000 people will know about this, and that can make a big difference.
That's great, Dr. Reese. And also, I would like to mention in our website, www.dfwcare.org, we also have a place for people to send in the requests. If you hear your friends and families, or even yourself in your workplace, in your hospital, that you're running out of PPEs, please go in there and fill out the information. We are looking at that. We have volunteers looking at that daily, and we're filtering out information, contacting people to understand their concerns, and then we send to different groups to take care of them. So please go in there and submit your request for your friends and family.
Okay, wonderful. I mean, what you guys are doing for the community is a blessing. How are you managing this? Are you taking care of yourself? Are you getting enough sleep?
Yeah, I'm actually a hardworking person, doing a lot of stuff normally, so I'm used to this kind of working hard. Okay. And luckily that I got laid off, and I'm kind of taking a break myself. Okay. And taking time with my high school daughter, who's gonna go to college this year. So taking time with her, and my mom's visiting from China as well. So we're kind of taking time to have a family time together. But this came along, so I kind of put that on the side, just focusing on get this going. So I kind of this is my full-time job right now, and more than full-time, I guess. Working besides sleeping, I'm working all day long. Just to coordinating with core teams, and also my team, and others, and and helping wherever I can, because we're really running against time. So I don't have the luxury of time for my own family, but I know what I'm doing is meaningful and saving lives.
Yeah.
Well, I can't think of a more admirable way for someone who got laid off to spend their time. So I thank you for that.
You're really focusing your energy towards this sense of purpose of being productive and like you said, saving lives. But thank you so much for all of this that you're doing, and for taking the time to even speak with us, because I know you stay busy on a daily basis. And just one last question, how are your volunteers staying safe?
Our volunteers are mostly kind of working from home, except the volunteers that's actually interacting, sending the goods, PPEs to hospitals, or helping out the picking up of the PPEs. So they are actually preparing the masks and protections themselves. They don't even want to use our donations, because they know our donations goes to the medical staff. So they just bring it from their home. And I also want to mention, a lot of the volunteers are working, and working still, working from home.
A full-time job, yes.
Full-time job, and plus doing this. So, they're just amazing. So I'm kind of, even though I'm using my own time to do this, but they're using their, their spare time, any of their spare time, for this effort.
Keren, thank you so much. We've enjoyed speaking with you, and also I've enjoyed working with you guys, and I know that I'll continue to work with you and reach out for any of our hospital needs. And then again, if I can be of service to you guys, you have my number and you know how to reach me. So again, thank you so much.
Yes, and thank you to our listeners. If we've given you the information, we'll include the link in the description as well if you'd like to help or volunteer in any way that you can. And today we were speaking with Keren Wang, that's W-A-N-G, and she is with DFWcare.org. Thanks for listening to this podcast.
Okay, Keren.
Yeah.
I'll talk to you soon. Take care. Bye-bye.
Yes.
Bye.
Take care. Bye-bye.
been listening to the Plant-Based DFW podcast show. If you like our content, please like, share, and leave a review. Our goal is to provide quality episodes to help support the community.